We have a way of thinking about joints in medicine. When they wear out, you replace them. Like a car part, like a hip, like a knee. The metal goes in, the plastic goes in, the worn part comes out, and the patient is told, "You're fixed." That model has dominated orthopedics for 50 years. And for patients who have truly exhausted every alternative, it has given many people their lives back. I do not dispute that. But there is a question that model never asks. What if the joint is not a spare part? What if it is a living biological system that responds to signals, that can be supported, nourished, guided, that under the right conditions have more capacity for repair than the replacement model has ever acknowledged? That question is what this video is about. What if your joint is not a spare part but a living system that responds to the signals you give it? I am Dr. A.K. Venkatachalam, founder of the Madras Joint Rejuvenation Centre in Chennai. I am a fellow of the Royal College of Surgeons, UK trained with 4 decades in orthopedics. I spent much of my career performing knee replacements. I have seen what surgery can do at its best and at its worst. I now practice exclusively joint preservation and biological treatment. And in this video, I want to introduce you to a concept that sits at the foundation of everything we do at MJRC. Joint stewardship. Not a treatment, a framework, a way of thinking about your joint that changes what you do next. What stewardship means. A steward is someone who takes responsibility for something entrusted to them. Not ownership, stewardship. The careful, active management of something living. In medicine, we rarely give patients this role. We give them a diagnosis, we give them a recommendation, we give them a date for surgery. And the patient becomes a recipient, passive, waiting. Joint stewardship is the opposite of that. It says you have a living biological system, a system that receives signals, and you, the patient, have the ability to influence those signals. This is not wishful thinking. This is biology. Cartilage cells, chondrocytes, are mechanosensitive. They respond to load. The synovial fluid that nourishes cartilage is pumped by movement. The subchondral bone beneath the cartilage responds to the metabolic environment of the whole body, and the biology of biological repair, growth factors, regenerative cells, healing cascades is profoundly influenced by systemic metabolic health. The joint is not isolated from the body, it is embedded in it. And what happens in the body happens in the joint. Joint stewardship is the active, ongoing management of a living biological system, not passive, waiting for deterioration. This challenges a common patient instinct. The first signal your joint receives is load. And here is the paradox most patients misunderstand. Both too much load and too little load are damaging. When a patient is in pain, the instinct is to rest, to protect the knee, to stop loading it. That instinct is understandable. And in the short term, relative rest has a place. But in the long term, a joint that is not loaded is a joint that is not nourished. Cartilage has no blood supply of its own. It receives its nutrition through compression and release, through the mechanical pumping action of load. When you walk, even with arthritis, you are pumping nutrients into cartilage. You are pumping waste products out. When you stop walking, that pump stops. The goal is not to avoid load. The goal is to find the right load, appropriate, graduated, consistent. Not impact. Not impact sport in a compromised joint, but purposeful, structured, progressive loading. உங்கள் முழங்காலுக்கு சரியான அழுத்தம் தேவை. அது இல்லாவிட்டால் குருத்தெலும்புக்கு ஊட்டமே கிடைக்காது. Cartilage has no blood supply. It is nourished by load. A joint that is not loaded is a joint that is not nourished. The second signal is movement, related to load, but distinct from it. Synovial fluid, the joint's lubricating and nourishing fluid, is not pumped by the heart. It is pumped by movement. Every time you move your knee through its range, synovial fluid circulates, nutrients reach the cartilage, inflammatory byproducts are cleared. A stiff, immobile joint is a joint in which this circulation has slowed, where inflammatory mediators accumulate, where the biology of repair is impaired. This is why physiotherapy is not optional in joint stewardship. It is not an add-on. It is not something you do when you feel better. Movement is medicine. Structured, guided, progressive movement is one of the most powerful biological interventions available for an arthritic joint. And range of movement matters. In Indian daily life, sitting cross-legged, performing namaz, squatting, these are not just cultural practices. They are full-range mechanical stimuli. When patients return to these after treatment, we take it as a clinical signal, not just quality of life. A biological marker. Movement is medicine. Synovial fluid circulates only when you move. A stiff joint is a starved joint. The third signal, metabolic environment. The third signal comes from inside the body, not from the joint itself, from the metabolic environment the joint lives in. See my video, Why Orthobiologics Fail Without a Metabolic Foundation. I made a detailed video on this, and if you have not watched it, please do. The link is in the description. But let me summarize the essential point. Your blood sugar affects your joint. Elevated HbA1c, chronically high blood sugar, degrades the joint microenvironment. It damages small blood vessels. It impairs healing. It creates a glycemic load on cartilage cells that accelerates their decline. Your vitamin D level affects your joint. Vitamin D is not just a bone mineral. It functions as a cartilage hormone, regulating chondrocyte activity and as an immunoregulator, controlling the inflammatory processes inside the joint. Deficiency is extremely common in India, and it is correctable. Systemic inflammation affects your joint. Hs-CRP, high sensitive C-reactive protein, measures the level of chronic low-grade inflammation circulating in the body. A joint does not live in isolation from that inflammation. It is bathed in it. And triglycerides, blood lipid levels, reflect the quality of the metabolic environment in which your regenerative cells exist. Lipotoxicity degrades the very tissues we would use to repair the joint. The metabolic environment is not background noise. It is signal. And unlike the grade of your arthritis, which you cannot reverse, the metabolic environment is something you can change. The grade of your arthritis may not be reversible. The metabolic environment it lives in is the fourth signal, biological support. This is where PRASAD treatment enters the framework, not as a sales point, but as a fourth pillar. The fourth signal is one that no amount of exercise, diet, or metabolic correction can fully substitute for, once the joint has reached a certain threshold of damage. When the joint is in active degeneration, when the subchondral bone has lesions, when the cartilage has lost significant volume, when the synovial environment is chronically inflamed, lifestyle signals alone are insufficient. The joint needs reinforcement. This is where targeted biological intervention becomes part of the stewardship program. At MJRC, that intervention is PRASAD. I have made a complete video explaining PRASAD, every step. I will not repeat all of that here, but in the context of joint stewardship, PRASAD is not a standalone treatment. It is the biological support pillar of a four-signal stewardship program: load, movement, metabolic environment, biological support. None of these works optimally without the others. A patient who receives PRASAD but does not address their metabolic environment is leaving significant benefit on the table. A patient who corrects their HbA1c and vitamin D but does not move the joint appropriately is similarly limiting their outcomes. And a patient whose joint has significant subchondral pathology, who exercises diligently and eats well, but whose joint never receives targeted biological support, may still progress to replacement when they might not have needed to. The four signals work together. PRASAD is not a standalone treatment. It is the biological support pillar of a four-signal stewardship program. When a patient comes to MJRC, before any treatment decision is made, we assess all four domains: load and movement, what is the patient's current activity level, what are they avoiding and why, what physiotherapy have they had, what is their muscle strength around the joint, metabolic environment, HbA1c, vitamin D, Hs-CRP, triglycerides. Where are they and what needs correction? Imaging, weight-bearing X-rays, MRI with subchondral sequences. What is the grade? Where are the bone marrow lesions? What is the biological potential of this joint? And then, only then, do we have a conversation about biological support. For some patients, the answer is correct the metabolic environment first. Begin structured movement. Reassess in 3 months. For others, the answer is PRASAD now, with metabolic optimization running in parallel. For a small number, the joint is beyond the reach of biological support, and replacement is the honest recommendation. I will not recommend PRASAD to a patient who would be better served by surgery, and I will not recommend surgery to a patient who has not yet had a genuine biological attempt. That is stewardship. On both sides of the consultation, I will not recommend PRASAD to a patient who needs surgery, and I will not recommend surgery to a patient who has not had a genuine biological attempt. Joint stewardship is not just a philosophy for early grade patients. It is relevant to you if you are a patient with early arthritis who wants to understand how to slow progression and protect what remains. A patient with moderate arthritis who has been told replacement is inevitable and wants to know whether biology can change the trajectory. A patient who has already had PRASAD and wants to understand how to maximize and sustain the benefit. A patient post-replacement in the other knee who wants to protect the remaining joint with a stewardship approach. And family members who want to support a parent or spouse beyond simply arranging surgery. Your knee is not a spare part. It is a living biological system. A system that receives signals, load, movement, metabolic environment, biological support. With the right stewardship, it has more capacity to be preserved and guided toward repair than the replacement model has ever acknowledged. If you want to understand whether your joint can be stewarded rather than replaced, reach out. The consultation link is in the description. And in the next video, we address something I hear from patients every week. I tried PRP, it didn't work. If that is you, that video is for you. Subscribe so you don't miss it. Your knee is not a spare part. It is a living system. Steward it.